And I remembered that I had met people that were in the School of Public Health and that University of Buffalo had a School of Public Health. So I just started looking into the different programs that they had, the different concentrations. Also within the School of Public Health there, they had like physical therapy. They had all kinds of different tracks that you could take. After researching and just talking to people, I realized like, wow, public health and getting a master's in public health is something that I really want to go after, really broaden my horizons, really be able to help people without being able to help people on a broader scale than just like individual patients. That was really exciting to me.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 104. Everyone, Omari Richards here. Be sure to follow me on Instagram at the PH Millennial. If you have not as yet, subscribe to this podcast, leave a 5-star review, tell me what you think about the show, share with a friend, greatly appreciate that. If you want to support, you can go to the public health store, which is at thephmillennial.com/shop, and check out the merch that's available there. Be sure to join the Discord channel as well, trying to get an active community of public health people to not only talk about public health and career progression and all their journey and all that good stuff, but as well as like focusing on the wellness and just making sure that public health people are good so that we can help our communities. Today's episode, I really enjoyed it. I learned a couple new things that I didn't know before. This person works for an organization that many of us probably have heard of when we were in our Masters of Public Health program or even our Bachelors program, and it's doing a lot of cool work. And I think the really cool thing is around the equity accreditation. And I said that word very well this time. I messed it up in the episode quite a few times, but regardless, it was a great episode, a lot of great information. And I hope that you all get some great insights and some great takeaways from this episode. Enjoy. Today, we have a writer, healthcare quality professional, as well as a public health policy expert. She got a Bachelor's of Science in Nuclear Medical Technology and then continued to go on and get her Master of Public Health at the University of Buffalo. She is currently the Manager of Accreditation Policy at the National Committee for Quality Assurance, or NCQA. We have Melina R. Bowdwin, MPH. Welcome to the show.
Thank you. Thanks for having me.
Pleasure is mine. Always happy to connect with new public health people, and love having the opportunity to share my platform for you to share your story. Tell me, how are you doing? How are you coping? How have these times been for you?
I'm doing well. I feel like I'm finally kind of crawling out of the pandemic hole that I've been in these past couple of years. Things seem to be looking up somewhat, so I'm just getting myself back together after a long couple of years. How are you?
Yeah, I feel the exact same way. Trying to get used to things changing, getting back more to normal, and just getting back to more normal, quote unquote, life. And hopefully things continue to trend downwards and we continue to be able to get out into community and just do things that we weren't able to do over the last 2 years. So yeah, I'm doing well. I cannot complain whatsoever. And as I always say, always happy to be on here sharing more public health stories with people. So I'm glad that you can make some time to come on here as well.
Yeah, thank you.
My pleasure. So tell us, how do you identify, and tell us a little bit about your personal background.
I identify as Black female. My pronouns are she, her. And my personal background, I grew up on Long Island in New York, and actually went to school also in New York, but all the way up in Buffalo, very cold and snowy. I, as you mentioned, I stayed there for 4 years, got my bachelor's degree in nuclear medicine, and then decided, hey, why not? Let's get more snow, and stayed another 2 years. to get my public health degree, my master's in public health. And then after that, I've had enough. So I moved back to New York. And currently, I am in the Washington, D.C. area. And that's where I'm currently working at NCQA.
Okay, awesome. Yeah, well, thank you for sharing that little overview, and I look forward to diving into your story and you going from Long Island to Buffalo. With that, I'm guessing that you enjoyed it enough to stay there to get your master's of public health, right?
I was there already, so I figured let's just chug it along for another 2 years. It went by really quickly, so. But after that, I was like, I can't stay here. It's too cold. It's too cold. The sun never comes out. Yeah, so I left.
Completely understand that, and yeah, I feel like that in itself, you just saying that 2 years passed by very quickly is great insights, because I felt the same way. Everyone thinks like, oh, the masters of public health is going to take so long, but everything just really flies by. So say that to say, be present in your program, do what you can, and take on experiences as they come by.
Yep.
Okay, so before we hop into your collegiate academic start to your journey, I wanted to ask, what does public health mean to you?
I had to think a little bit about this one because it means so many things, but I think mainly it just means people consciously and actively participating in their health journey, like partaking in healthy habits, knowing when to seek medical care. I feel like in school there was sort of this rhetoric that if you just ate healthy and you exercise, you'll never get sick, you'll never go to the doctor, and you'll never get any kind of disease. And I feel like that's not necessarily the case. There's a kind of necessary evil of having to interact with our healthcare system, and it's so vital to public health and prevention. And so that's why the two fields seem to overlap a lot. And so knowing the ins and outs of insurance coverage, being able to be your own advocate when you're interacting with providers, and being part and doing your part as a patient will all lead to improved health outcomes and improve the health of the public if everyone sort of does their part in their health journey.
Yeah, absolutely. And I like that you point out the rhetoric part of, exercise and eat healthy and you'll be okay. And
Yeah.
that kind of like just downplays all the other societal and systemic and infrastructural issues and systems that are there that are interacting with our health. And maybe downplays just like us thinking about public health as broad as we can from a young age, because it's just focusing on maybe these more individualistic characteristics as opposed to all the other levels and interactions that do affect your health. So I appreciate you sharing that. Okay, so hopping into your bachelor's degree here, and I think this is a first for the podcast as well, a Bachelors of Science in Nuclear Medicine Technology at the University of Buffalo. So what was going through your head? I guess firstly, did you enter University of Buffalo as a nuclear medicine technology major?
I did not. um, it's a very uncommon major. I entered UB with the idea that I was going to go to medical school. So I did the whole pre-med track, at least starting out. I actually started out as a pharmacology major and decided that it was really hard and that there was a lot of classes that I just got really intimidated by and really skittish about. And I learned that, being a doctor really wasn't in my heart. So then I started to think about like what else I could do. And I'm a very practical person. So, I was hearing in the ether that, getting a bachelor's degree, you're not going to be able to find a job with just a bachelor's degree. You have to go on and this and that. And I said, you know what? I'm going to find a major that's going to get me a job when I graduate. And I looked at the website, saw what they had to offer, and I came across nuclear medicine, and it said you have patient interaction. It's like you're injecting like radiopharmaceuticals, and I was like, that sounds cool. So I just signed up for it, and that was that.
Okay, that's fascinating. And when in your journey did you switch from pharmacology or whatever it was before to nuclear medicine technology?
I think it had to have been sophomore year because I would have had to start the nuclear medicine courses junior year. I think in my freshman year, I really started to be like, oh, I don't know if this whole medical school thing is for me, and started to think about it. But I think I actually made the change in sophomore year.
Okay. And going back to that, what was the basis for you wanting to go into school and go into medicine? Like, what was that thought process?
I guess I've always just had an affinity to the sciences. And in high school, my favorite class was anatomy and physiology. So, you know, I figured that would have been the best use of that interest. And it just seemed like it would be a cool thing to do. I didn't really have like my parents pushing me to do that or anything like that. It's just something I thought like, yeah, this sounds like it would be a good idea. And I like science and I like health related things and I like anatomy. So I figured that was the way to go at the time.
Okay, and that's not something you hear very often. People like in anatomy. I feel like many people that I went to undergrad with, I actually never did anatomy as a biology major, which is blows my mind, first of all. But
Yeah.
but yeah, a lot of people really disliked anatomy and anatomy lab. So it's interesting to hear you say that you enjoyed it, but I'm glad that you enjoyed it though.
Yes, I am not like most people. I love science. So if there's a science class, count me in.
Awesome, awesome. But not pharmacology though.
Not pharmacology. There was a lot of, the problem with pharmacology was that there was a lot of chemistry,
Mhm.
and chemistry is one of my weaknesses. I will do physics, I'll do biology, I'll do anatomy and all the rest, but chemistry for some reason was just always not my greatest strength. So,
Yeah, fair enough. Well, wasn't mine either. I had lots of battles with chemistry in undergrad, so I completely understand you switching to that. Okay, so I want to like just understand more about the switch for you from going from pre-med pharmacology to nuclear medicine technology. So was it literally like you just saying you don't want to become a doctor anymore and you're looking up to see what practical jobs you can get with still that patient experience and like having some sort of like helping other people? Sorry for quoting that for people that are watching videos. I don't mean help. You actually helping people. Sorry.
yes. It had a lot to do with like, I really enjoy like speaking to people and I enjoyed that patient interaction. So I was really looking for that. And actually, I was weighing my options of medical technology, which is like laboratory science, versus nuclear medicine technology. And I was like, okay, which one can I do? They'll both get me a job right after I graduate. But nuclear medicine really spoke to me because of that patient interaction. I mean, when you're a medical technologist, you also have patient interaction, but there's just something about it that kind of spoke to me, and I realized, oh, this is kind of in like in the radiology field, and I was a little bit familiar with like x-ray and things of that nature. So yeah, it was what you described. Literally, I looked at the website, saw what they had to offer, and just said, hey, why not? Let's do this.
Fair enough, fair enough. And that's the one thing that I like about North American schooling system is they give you that flexibility to shift and change and do as you like. Because I want to say on average, people change their majors like 3 to 5 times during undergrad, which is pretty crazy, but it works. It works for a lot of people. So but
Yeah, especially if you're taking classes that are similar to the majors that you're trying to switch to, it just makes it easier.
that is true. That is true. So that is one benefit of the questionable U.S. Education system. Okay.
Questionable.
There are a lot of things that could be done a lot better, but this is not a podcast about that.
This is another story for another day.
Exactly. So during your bachelor's, you were a campus health educator at the University of Buffalo. So how did you get into that position, and when during your schooling was that?
That was during my I believe it was during my senior year. So I was in a program called C-STEP in college. It's called Collegiate Science Technology Entry Program. It's for students of color who are in STEM majors, science, technology, all of that. And it was the first year that they were introducing this program. And I had been kind of involved in their other initiatives. And so I decided to apply, and then I got it. It was a kind of like a service learning program where we learned a lot about organ donation. That was the whole premise of the program, was to try to increase the number of people who were becoming organ donors. So we learned a lot about that, and then we went back out into the community, aka the school community, to educate them and to try to get people to sign up. Just letting them know the importance of organ donation and how it saves lives and all of that stuff. So it was just a matter of being a part of a program that was already existing, and then having them wanting to roll something out, and then being in the right place at the right time and applying, and getting that position.
Okay, that's awesome. And tangential but relevant. Like randomly, I was on LinkedIn, I think it was yesterday, and there was an article that popped up about the inequities in organ donations or organ transplants or something like that. And I was like, damn, it's like the inequities and all these things that we just don't even think about. But I appreciate you doing that work. Very, very important work. What was there? Because in your nuclear medicine technology like major, was there onus on like is there a lot of focus on that health education part, or was that something that you just saw as something as another way of like helping people, helping patients? Tell me more about that.
Yeah, it was another way that I could connect with people. I think I have this strong affinity to want to connect with people and talk with people. So that was just another avenue. The nuclear medicine stuff is very technical, and there's patient interaction, but they don't really focus on education. It's more so there are certain procedures, you learn them, and then you do them with patients. So this organ donation, this campus health educator position was a really fun way to connect with like the students that were on campus, and really help them to see, because there's a lot of stigmatization around organ donation, as you probably know, and just to help them understand the importance, demystify a lot of things. And it was just really enjoyable, like putting together like a curriculum, if you will, and just going out there and getting to know people, educating people, and helping them to convert, if you will, to being organ donors.
Okay, yes, we need more converts to the organ donor list. That's for sure. And I think especially for Black, Brown, Indigenous people, because I feel like there is that lack, as I stated earlier, the inequities in the transplants and stuff like that. So
Yeah.
so the question about nuclear medicine technology, sorry. So someone with a nuclear medicine technology bachelor's, they become a nuclear medicine technologist.
Yes.
And what is that exactly?
Sure. So it's a branch of radiology. So like X-ray, CAT scan. Except the only difference is that X-ray, CAT scan, there are like anatomical imaging. So it's like the bones, you see like structures in the body. Whereas with nuclear medicine, you can really see the function or the physiology. So it's imaging within the body, but it's really showing the function. So if you do a cardiac scan, you're able to see the heartbeat, like actually pumping blood, and you get to see the output and know like the function of it, as opposed to the way it looks like structurally. So it's literally just going in there, getting your radioactive isotope, starting an IV, injecting it, letting it do its thing, work its way through the bloodstream, and then taking images. There are different compounds that go to different parts of your body. I won't get into the details, but it's just imaging the functionality of the body so that you can see things such as the way your heart functions or the way your kidneys function. And you get to see things in real time and take different frames and put it together as a video. So you can see literally like the kidneys emptying into the bladder. It's really cool. But yes. So
Okay.
that's what it is. It's just imaging the inside of your body, but more on the functionality of it as opposed to the structure or what it looks like.
Okay, well, thank you for sharing that. I'm guessing myself included and all the other listeners mightn't have known what that is, but as you explained it, it makes a lot more sense. So I appreciate that.
Yeah.
Um, So did you have any other undergrad takeaways that you wanted to share?
I think for me, and I'm sure other people can probably relate to this, is that as much as undergrad is like extremely important to your future and your career, one thing that I took away from it that I wish I had done differently is to just have more fun in general and just really explore aspects outside of my schoolwork. Of course, I had the campus health educator stuff, but that was very much related to my career path. So I just wish that, and I advise people to really get the most out of it by focusing on, yes, school, very important, but also focusing on your interests outside of school, because that's also really important to your career development as well.
Yeah, I absolutely agree. I got interviewed on my podcast, episode 100, and that's a similar thing that I shared during my undergrad. I didn't. I'm originally from the Caribbean. I didn't even like participate in the Caribbean Student Association until I was like 2 years into school. I was like, "What are you doing?" Because and I think it's just all those like other experiences, the way you can have fun that people need to take advantage of, just get exposure to, get experience, meet people, network, all that good stuff. So I appreciate you sharing that.
Yes, it's so important not to take yourself and your schooling so serious. I mean, you can take it serious, right? Paying a lot of money in a lot of cases, and you want to get your the best that you can out of it, but definitely just enjoy yourself for sure.
Yes, yeah, that's a huge part, huge part. Okay, so you switched from pre-med to, well, pre-med path pharmacology to nuclear medicine technology because you wanted a practical way to get a job after your undergraduate. However, you didn't become, well, at least from my knowledge. Oh, you did. Okay, sorry, I'm misstepping it. You did do some nuclear medicine technologist work, as I see here, but
Yeah.
what was that onus for you wanting to go into a master's of public health? Before you answer that, when did you know public health was a thing?
I think I knew it was a thing through the campus health education program that I was doing, because I was it was actually a group of students. I don't know if I mentioned this earlier, but it was a group of us who were doing this work around campus, and we were all STEM majors, and there were also people and students who were in like the health field majors, and they were in the School of Public Health at University of Buffalo. And so just meeting them, that's when I kind of knew there was like a whole new world outside of like medicine that existed that had to do with improving health for individuals.
Yes, yes. Okay, so that's important in saying that you got exposed to this health educator job, you were able to get exposed, get experience in it, and then from that you'll be able to get exposure to people with their MPHs, or knowing that there is this thing called public health, which many of us going into undergrad who want to help people, who want to make a change in society, just don't know existed. So I think it's just so important to have all those different avenues and ways to get exposure to public health. Hence why I have this podcast. I think it's just important to share this story so people know that public health is a thing. People are doing amazing work in it. Um, so you said you wanted to go into your nuclear medicine technology to get like a job afterwards. So why did you also, because you worked as a nuclear medicine technologist, as we'll talk about in a bit, but why did you want to get the Master of Public Health as well?
So I was about a year or so into the nuclear medicine program. And I realized while it was very, like, really cool work and it was really exciting, I realized that it was a little bit like one dimensional, meaning like I felt as though I was going along like a singular path and there wasn't really ways to branch out and like do different things with it. It was just pretty much you can be a nuclear medicine tech, and the only other option outside of that was to be like a health physicist, which is like like it's like public health work, but it's like you're in like environmental health. Um, so I was kind of just like, okay, I want to do more. I want to be able to broaden my horizons and learn about different aspects of health outside of medicine. Um, and I remembered that I had met people that were in the School of Public Health and that University of Buffalo had a School of Public Health. So I just started looking into the different programs that they have, the different concentrations. Um, Also within the School of Public Health there, they had like physical therapy. They had all kinds of different tracks that you could take. But after researching and just talking to people, I realized like, wow, public health and getting a master's in public health is something that I really want to go after, really broaden my horizons, really be able to help people without um, being able to help people on a broader scale than just like individual patients. Um, that was really exciting to me.
Yeah, and I think it's a fundamental change in how we think, because I feel like many a time we don't think about that population level or like community impact, as opposed to saying, okay, this person is like going back to what you were saying earlier, like eat well and exercise and you be healthy. That's very individualistic, as opposed to, let's say, let's make sure that we have the policies and infrastructure that people have sidewalks and they have lights outside and they have parks that they can go to and be active. So yeah, I appreciate that. I know everyone else who listens to this and appreciates public health appreciates that as well. So what was the concentration that you chose?
I chose community health and health behavior.
I'm,
And
I'm
it was very difficult to choose a concentration. I don't know if you've had the same experience, but I was looking at all of them and I was like, I don't know. But I got really interested in the community health piece from doing the campus health educator when I was doing that in my undergrad. So
yeah, that makes sense. And I do believe it's so difficult, like as a opposing the undergrad system where you're like allowed to change your major as many times as you want technically. um when you get into your masters of public health, they're always asking you beforehand, when a lot of people don't even have experience in public health, to choose a concentration. So it's such a tricky thing, and I know many schools don't allow you to change your concentration. Some of them do.
mhm.
So it is a tricky thing, but I'm glad that you were able to have like that exposure and that experience that really said, okay, this is the concentration I think best fits me going forward in the type of work that I want to do. So that is awesome. And I'm guessing that there was no gap in between your bachelor's and your master's.
No gap. For me, I thought about it briefly, but I said realistically, I don't want to lose steam. And someone had actually given me really good advice. They said, hey, once you start working and like really making that money, you're not going to want to go back to school. So I kind of took that and said, okay, knowing myself, that's probably going to be the case, especially because I was a nuclear medicine tech, you know, you make pretty good money right out the gate. Um, so I wanted to give myself the best chance of finishing. So did it right
Yeah.
after.
Okay, makes sense. And I think the key there is you know yourself. And I think self-awareness is key in knowing and approaching life in so many ways. But with MPH and everything like that, and knowing if to take a gap year or not, it all depends on yourself and your situation and what you think is best for you. So really be self-aware and reflect on that. That's a key highlight there.
Yes,
Yeah.
absolutely.
Yeah. So you are in your Masters of Public Health program, and you are working as a nuclear medicine technologist at Windsong Radiology Group PC. So When did you start both of them at the same time? What was that process like for you?
Yes, I started working right after undergrad. I actually started working at the same clinic that I was in, like doing my practicum. I think that's what you call it. Um, I took my exam, I got my license, and then I started working there afterwards. And then in the fall is when I started my MPH program. So I worked per diem, but I really was working like part-time hours. And sometimes they wanted me to work full-time hours, which wasn't really that possible because I was going to school full-time.
Okay.
So, yep.
Yeah.
Luckily, a lot of the classes in the MPH program were in the evening. So it was easy to work during the day and then go to class afterwards.
Yeah, and I think most programs try to structure themselves with that kind of flexibility because they know they have students with all types of backgrounds and coming in at whether that's like right after undergrad, you're working or you have like a family or whatever those I don't know the word that I'm trying to find there. Well, whatever the circumstances that you're coming in, they for the most part they try to be accommodating to that type of work. And so I'm guessing that there isn't like much more. Is there much more than what you said a nuclear medicine technologist does that you would like to share about this role that you were in, or everything that you said is okay? Was there like a specific part of the body that you worked with more or more an organ that you worked with more than others or anything like that?
Um, I did all over. I did bone scans, I did kidney scans, I did thyroid, cardiac. I worked in a cardiologist office too. You probably saw my resume that I worked at Western New York Imaging Group, and that was part of that was operating in a cardiologist office. So I did a lot of cardiac scans there. Um, Hepatobiliary scans, like liver scans. Lots of, like all over the body with the exception of brain scans. I didn't do those. Those are made me very squeamish because you had to do like a spinal tap. And yeah, I remember being a student and I was like about to faint when I was watching one once. So luckily I didn't have to do those, but yeah, lots of lung scans. Those were like the emergency, people were having pain and we would get those added on all the time. Um, So yeah, I mean, I worked in an outpatient clinic, but there were some emergent cases that would come in, or just last minute add-ons. But other than that, it was very busy. Lots of moving parts. You have to move very quickly, and you have to be careful because you're working with radioactive materials. And New York State will come after you if you're not on your P's and Q's. Um, so yeah,
Okay,
it was a
and
lot of fun. In the time while it lasted, I had a lot of fun.
that's good. It's always good to have fun. And is there any advice that you would give to someone if like their end goal was to become a nuclear medicine technologist?
I would say to really study, um, because a lot of the time you're working. I mean, when you're in the healthcare industry, things move pretty fast. It's pretty busy, and if you don't know like the next step, then you can kind of get all turned around. So just studying the procedures, knowing like what is the dose for bone scan, what is the dose for a lung VQ scan, knowing like your 3 points of identification for a patient and making sure you have the right patient and it's the right time and all of that stuff. Just being like really aware and studying up on what you need to know in order to do your job is what I
Okay.
would say.
Okay, awesome. I appreciate you sharing that. And anyone that is interested, some great advice right there. And I guess how was that balancing both the MPH and working as a NMT? I don't know if that's an acronym people use, but I'm
It
gonna
is.
use it. Okay.
Yeah, it is. Um, it was really hard. Because at the same time, I was also an RA. I don't know if I mentioned this before, but I was working in the on-campus housing. So there was a lot with that. So I kind of was doing a lot at the same time, but I was just very organized, and made sure that, I wasn't working on the weekends because I worked in an outpatient clinic. So I made sure on the weekends I was like in the library. You can ask anyone who knows me. Like it was like Saturday morning, I was in the library all day doing my work, and then Sunday was kind of like the same thing. And then just anywhere in between classes, I was trying to get my work done. There's a lot of writing that goes into an MPH that I didn't realize, because in my undergrad, I didn't do a lot of writing. I took a lot of science classes and there was a lot of labs and things like that. So just trying to get those papers out was really difficult for me, but I did my best and made sure I was diligent and in the library and just studying all the time.
Okay, okay. Well, I'm happy for your grind and, and for you being able to come out on the other side. That definitely seemed like it was worth it. And looking back, was it worth it? Was that a good decision for you?
I think it was. I don't regret any of it, but it's kind of the same thing I was saying before with undergrad is just I wish I had a little bit more fun and lightened up a little bit during my studies, but it got me to where I am today, so I can't complain.
Yeah, yeah, it's a good place to be. Absolutely. And were there any other takeaways from your Masters of Public Health that you wanted to share before we move on to your next position?
One thing I would say, and this is just a point of advice for anyone listening, is to pay attention to what you're learning. As much as I studied, like I pretty much would study for a test and then I would like forget everything afterwards. And I'm sure people can relate to this. But what happens is like with Masters of Public Health is a very practical degree, which means that you are using a lot of what you're learning in school in your actual day-to-day job. So as much as I forgot about like Pareto charts and things like that, I was using them at work and like frivolously Googling things of how to read them. So that's one takeaway is just, pay close attention. And then my other takeaway would be to not be so afraid of data. I think you go into a public health program and everyone's like, oh my God, epidemiology and biostatistics, like it's so hard. And they are really challenging courses, but, and I think they make a lot of people jaded by data and kind of intimidated by it. But data is the air we breathe in this industry. You need data to be able to make decisions, be able to inform policy, et cetera. So don't be afraid to dive in and like really learn the ins and outs of the principles of epidemiology, data, how we use it to make decisions, et cetera.
Yeah, I think that's very important, especially in public health, as you stated, because it's a lot of synthesizing information, which is data, and putting that out to share to different populations, different stakeholders, so that they can understand it for their context. So yeah, don't be afraid of data, and I think like even for me, having that switch of don't go into classes that you might think are difficult and view them as difficult. Just go in there, don't put any judgment on it, and just do your best, because when you do put that judgment on, it just changes the entire demeanor towards the class. And you don't want a negative demeanor towards the class, because it just makes everything around the class a lot more harder.
Yes, I would agree with that for sure. It's all about your mindset and how you approach it.
Yeah, for sure. Okay, so another question before we go on. So after you graduated, you were a program assistant at Stony Brook Medicine.
Mhm.
But what was the question I was going to ask? I do not. Oh, yes, my question. My question. So, so after you graduated, you're a program assistant at Stony Brook Medicine. Was your plan during your MPH to switch out of the NMT role, or what was that thought process? Because you already have the degree to do this role. You said it pays you well. while you're still doing your MPH. So was that an intentional decision to shift out of NMT to go into more public health work, or what was that thought process?
Sure. So my plan was to, after I graduated my public health degree, my plan was to spend about 5 more years doing the NMT work. However, I was moving back to Long Island, and I did apply to a bunch of jobs, nuclear medicine tech jobs, but you know, not many people have heard of nuclear medicine, which means it's a very rare field, which means it can be very saturated. So it can be difficult to find work. And a lot of the work that was available was like per diem or part-time work. And so that just, for me, I was looking for something full-time. So I did try to continue on, but it was just really difficult to find work because of how small it is and how rare it is. And a lot of people kind of become a technologist and they kind of stay a technologist. So you kind of have to wait for people to retire out of the field. And I just didn't want to wait. So I just decided, hey, let's start applying to other types of jobs that are in the field of public health, since this is what I'm getting my degree in. And that's kind of how I went that route.
Okay, that makes sense, and that is important in itself. To I feel like a lot of people in public health, depending where you are geographically, there are more public health jobs than in other places. There are like more specific public health jobs. Same, like for instance, NMT. There's, as you said, it's a very saturated field. Some roles are saturated, and knowing where you are and if there are a lot of those types of roles, I think is important in like thinking about what is the path for you going forward in your future, because some places are going to have a lot more funding for a lot of public health type roles while others are not. So really think through that when you're like going to school, when you're applying and thinking about where you want to live and work, and all of that good stuff, because I think that is something that a lot of people don't think through, and then when it's too late, they're like, oh crap, there aren't any jobs in this location that I'm trying to work in. So just be proactive in doing that. Okay.
Yeah.
So you were a program assistant at Stony Brook Medicine. So how do you come across that? Well, you told me how you came across that. So what did you do in that position?
I was a program assistant for the DISRIP program. Um, I'm not going to remember the acronym right now, but basically it was a Medicaid program in New York State that kind of recouped funds that were fraud, basically Medicaid fraud funds, to like recoup them back into the community to help improve the health of individuals and communities. Um, so I was supporting different project managers that were managing different programs in the district program. So there was one for behavioral health, there was one for cardiovascular disease, there was one around tobacco cessation, which is one of the projects that I was actually heading up at the time. So just supporting them in their work to improve outcomes in those areas. And then I also was in charge of the newsletter, writing the content for that, and putting that out every month. And yeah, it was very much like administrative assistant type work and just supporting. And then I really did get to, though, with the tobacco cessation project, kind of take that on as my own, and that was really nice. It was my first exposure to like being in a leadership position, so that was really cool.
And to that point, what do you think made you successful in that, or what were the things that you did to do your best in this role, not having had leadership experience before, or formal leadership experience before?
I really did lean on my coworkers, because a lot of them were already in leadership positions or they had been before. So just kind of absorbing and observing them. And also I had a really supportive boss at the time. My manager, like she was really great at like pushing and saying like, you should do this. Like when she first told me about the tobacco cessation thing, I was like, really? Like, like I don't know how to do this. And she's like, you kind of just have to get out there and take the leap. And so that's kind of what I did. I didn't stay in that position for very long, mostly because of the commute. It was out in Stony Brook and it was very far to drive. And if you're familiar with New York traffic, then it was really a struggle every day to do that commute. But for the time that I was there, I really looked and I learned about like what leadership looked like. That was like kind of like my first exposure to that, at least in public health.
Yeah, and it just shows the importance of like having people in roles above you that are kind of like advocating for you to get experience or take on more responsibility. And I think that is hugely important, especially for people that are recent graduates or just young professionals, to have those kind of people supporting them along their journey.
Mhm.
And then the other parts of your role that you mentioned, you did like newsletters and stuff like that. You said that you didn't do much writing in undergrad. You did a lot more writing in your MPH program. I'm guessing the writing that you did in your MPH program might have been similar to a newsletter, but maybe not so much. So how did you develop that skill set?
Well, actually, even though I didn't do much of it in undergrad, like writing is something that comes pretty naturally to me. So it didn't really feel like that big of a deal. When I was in my MPH program, I was very much not used to the idea of like a literature review. So I struggled with that. But in this particular role, there was just a lot of like interviewing that I had to do, and then kind of like synthesizing that information into like little like tidbits in the newsletter. So I didn't mind it. I didn't find it to be that difficult just because I naturally can write pretty well. Um, and then it was really fun, like designing like pictures and all of that. Like I find that stuff like pretty fun. So I didn't mind it.
Yeah, it's great. It's always great. I feel like when you can add a little creativity to the roles and the jobs that you're able to do. So that's awesome. Okay, so you decided to switch out of this role because your commute was way too long. New York traffic, New York traffic is a lot. So after this, you became a senior data analyst at IPRO or IPRO. I don't know if it's one or the other.
I, yeah.
IPRO. Okay. So how do you come across this, and then what do you do?
Funny enough, so when I was not undergrad, I'm sorry, when I was in my MPH program, I did my internship at a health plan up there. And I got to know the people that worked there really well. I got to know the chief medical officer. He actually graciously agreed to be in my documentary that I created for one of my classes. And so he helped me out by sending my resume to someone that he knew at IPRO. And I ended up applying for a data analyst two role, not a senior data analyst role. And they ended up interviewing me. But what happened was the position at Stony Brook and the position at IPRO kind of like overlapped with one another. So I ended up taking the position at Stony Brook, and because I didn't hear back from IPRO yet. So I was at Stony Brook. I decided after a short period of time that I was going to transition out, and I said, "Hey, I remembered IPRO. I interviewed there. Wonder if they're still looking for someone." So I reached back out to the hiring manager there, and they pretty much offered me the job because it wasn't that long ago that I interviewed. So they ended up offering me the job and did a little bit of negotiating and ended up with the senior data analyst role there.
Yeah, that's you're gonna
Go
say
ahead.
something? That's awesome. Like one thing I wanted to highlight there is like reaching out to the HR manager. I think like that is key. Like whether you're applying to a job now and you're like on LinkedIn and you can see the person that's there, like talk to the people. want to talk. They want to get someone who's a good fit for their role. So like having those conversations is never going to hurt. So definitely do that. And then earlier in the interview, you said that you were scared of data, or data wasn't like your best friend. So
Yeah.
how do you go from data not being your best friend to going into this interview and going from a data analyst to senior data analyst and getting that position?
Sure. First, I want to highlight, yes, it's very important to take the chance and reach out, because you never know. Because I reached out and I was like, oh, I'm probably never going to hear from them, like whatever. But they ended up reaching back out. So that was a very important point. But how I got unscared of data, was that I was at the Stony Brook position, and I realized, I kind of had an interest in, there was a whole like data and analytics department, and I was kind of interested in the work that they were doing, but I also didn't want to continue to do the commute. Um, and then I just kind of said to myself, I don't really know much about this because I've been so intimidated by it. So why don't I just kind of go and learn about it? And it went from data analyst two to senior data analyst because of, I wanted them to match my salary at the other place. Um, but I was very afraid, because you had to know like SAS and SPSS, and I didn't use any of those. When I was in school, we used Stata, and yeah, it was very intimidating, and there was a lot of learning on the job, lots of reading and Googling, and just really scrappy type of work to kind of catch up, and be successful.
Yeah, that's awesome, and that's real. I like that you say that, because you're going in there, senior data analyst. People are probably like, "Oh, she's amazing with data. She knows all Stata, R, SPSS, SAS, all of these." And that was not the case. But you were like, "Okay, I'm in this position. I'm going to learn. I'm going to make it not scary, and I'm going to take advantage of this." And it definitely paid off, because you got shifted or promoted into a project manager of the managed care at IPRO. So tell me about that promotion or shift, and then what do you do in that role?
Some of what I was doing as a senior data analyst was I did a lot of like surveys. So I would do, there was just one survey. It was like a 22,000 member survey, and we sent it out. We got the data back, and I had to figure out how to program in SAS, and so we could analyze the data. And luckily, and as an aside, when you're working somewhere, especially if you're in an already established project, there's history that you can go back and look at and see how things were done. So that's what I did with SAS and figuring that piece out. But pretty much I was managing the projects from start to finish, as a data analyst. Like, yes, I was analyzing the data and doing the reporting and all of that, but I was also in a leadership role and doing project management. And so that's kind of how I transitioned into that role. I was pretty much already doing the work essentially. And so after a little bit as a data analyst, I ended up becoming a project manager.
Yeah, and I feel like that's the best use case for becoming, like, being promoted or getting shifted into a position, is like just taking on more responsibility, and you're essentially doing the role without the title. And then
Yep.
you ask them to give you that title, the pay raise, et cetera, et cetera. So yeah, I appreciate you sharing that. And then you also got another shift or promotion, I'm guessing promotion, to assistant director of the managed care at IPRO. So tell me about that promotion and what you did in it.
Sure. So that one, that was an interesting one. A little bit into the project manager role, I started, as an aside, iPro, we work, or they, I don't know why I said we because I haven't been out that long, but they work in with different states around the country with different contracts. And so I was put on one contract in particular, and I had to pretty much take on this role of like leading the charge in coming up with performance improvement projects for the health plans in that particular state that I was working in. Um, and it's very similar to like you do. your barrier analysis, your interventions, you have your process measures and all of that. So I had to come up with like all of that for them. And that work was pretty much an assistant director type of work. So again, I was pretty much doing the work of an assistant director without being without having the title. So I was doing that, and then I was also leading the DISRIP work. I mentioned DISRIP earlier. It was still a thing at the time, and I was leading that as well. And then in addition, I was taking on more of a senior role in one of the other contracts that I was on. And so it was just a matter of like, there was just some moving parts. Some people left the organization. I kind of got more responsibility, more leadership experience, and then that just led into the assistant director role.
Yeah. And around the leadership experience part, was that something that like you intentionally set out to get, whether that's like through courses or conferences or something like that, or was it just something that naturally happened as you became more confident in your role and just took on more responsibility that way?
It was something that just happened. I wouldn't say I was like super confident at first, at least. I had like an amazing boss who pushed me again to kind of do more than what I maybe thought I could do. So I was really lucky in that regard. You know, she was really willing to kind of like step aside sometimes and be like, "Oh, you have the ability to lead this or to do this." So I just kind of took it on, and as people were transitioning in the organization, like I kind of transitioned with them, well, not with them, but like kind of after them into that work. So that's kind of how that happened. I didn't take any courses, but I just kind of was ready to help out wherever I could. And if that meant that I was doing a little bit more and delving more into leadership, then that's kind of what it ended up being.
Okay, that makes a lot of sense. Okay, another question on this before I move on. Um, so in IPRO, you had three different roles. You had a seemingly good career progression and professional progression. What advice would you give to students or professionals out there that are trying to get this type of progression in a similar type of organization?
I would say um, don't be afraid to do more than what maybe your job description says. And I feel like we're in this era where people are like, oh, I'm just going to do what I'm worth and I'm just going to do what's in my job description and that's it. But in my experience, the way that you really move around and move up is by being present and by saying, hey, I'll take that on. Or if someone leaves and you see that like their manager needs help, then you offer your help. Yeah, my advice would just be don't be afraid to do more than what is necessarily in your job description, because that's what's going to get you the proven track record, right? To be able to for people to be able to say like they're ready for this next step.
Yeah, absolutely. That makes a lot of sense, and I hope that people are able to take that advice and take it on. And I think like you hit it on the head, like just being open to taking on more work, more responsibility, being open to learning and saying like, I might know this, but I'm gonna take it on and I'm gonna figure it out while I do it, kind of thing, which I think is important. A lot of people shy away from that kind of exposure experiences, which I think is just necessary to kind of be uncomfortable and then get comfortable as you are in the role or in the position.
Yeah, one thing I just wanted to mention was that coming from the nuclear medicine role, it was very much a defined role. There were certain procedures that you had to know. Like you're basically very familiar with the work that you're going to be doing each day. But this was so different because I got into the public health field or just the healthcare field, and things were changing all the time. And it was like, okay, this person left, or there's this new work that's going on. And putting myself into that was what really changed things. And just being willing to get uncomfortable, because there was a lot of uncomfortable moments. There were a lot of moments where I was like, I don't know, like I'm not a programmer, but I had to figure it out. Or, I really don't have experience with, you know, creating process measures, but you know what, like let's try to pull something together. And then just realizing that a lot of this work is very scrappy, and like there isn't that much that's already established. There's the foundational work, but a lot of stuff is new and changing every day, and you kind of have to be willing to step up and step in and innovate, and don't be afraid to do so.
Yeah, totally agree with that. Okay, so I'm not too sure if this was a role or how this would, but you're a mentor for the Envision mentoring program at the University of Buffalo. And I have here that you were later a steering committee member as well.
Oh, yes. So those are just volunteer opportunities that I do on the side. So the first one is I am a mentor to undergraduate students in the School of Public Health at University of Buffalo. So in that role, I so far have mentored 3 students through helping them apply to MPH programs, helping them to get ready for the workforce, doing like resume writing, helping them with personal statements, like that sort of thing. And then my other role as steering committee member, so I think a lot of schools of public health are accredited. And so I am sitting on the steering committee for the next iteration of the University of Buffalo's School of Public Health Accreditation. So that just entails like helping them with the self-study that has to be done, helping them answer the questions that the accreditor asks, based on my experience within the program.
Okay, yeah. I was part of that process last year. I want to say for University of Florida, getting
Oh,
reaccredited. Yeah, very very interesting process, but I enjoyed it. People seem to stress out more than I think is necessary, but I don't know.
I mean, there's a lot riding on it, so I don't know.
there is that's for sure. That's for sure. Um, so in the mentorship that you do, is there like you said you had 3 mentors so far. Are there like one common challenge that you see current undergrad public health students dealing with? And like to that question, what advice do you give those people?
I think, let me think. I think the common challenge is when they're trying to get ready to apply for an MPH program, and they think that they haven't done enough in their undergraduate to be able to talk about in a personal statement or in a resume. Um, and what I try to do and what I've done is to really help them pull out the skills and the experiences that they've had that tie directly to what they're trying to accomplish, or the program that they're trying to get into, or the concentration. So, for example, I had someone who wanted to apply to jobs. Like her ultimate goal was to become like a program director for like at a health clinic. And so she's like, yeah, but I don't really have like any experience. Like I haven't done anything that directly correlates to that. But I'm like, you kind of have, because you were in this position. You worked as someone who did contact tracing for COVID. Like that's huge, and that's a skill that can directly translate to being a program director. Or I think she also was like leading like the educational initiatives that was at her job, and then just trying to help her see that like there's a lot here that could translate and bring you to this next point of where you're trying to go. So just kind of helping them to see past like what they've already done and really take that and realize it's a lot more than what it probably feels like. And it applies to a lot of different things that you can end up doing.
And I think
I don't
that
know if
is,
that makes sense, but
absolutely makes sense. And I think what that, like what I'm getting from that, and like just generally speaking to a lot of public health people, is you need to ensure that there are people ahead of you who are mentors who can help you see all that you are doing and can like talk that motivation into you when you're like trying to discredit yourself and all the great work that you're doing. But you sometimes need those other people to like kind of kick you and say, no, you've done all these
yeah.
great things, and you deserve to get this role, get into this MPH program, whatever that case might be. So I think really just having those relationships are important for people's development. So thank you for that work. Thank you for that work.
Yeah.
Now getting into your current role, you're a manager for accredited you are the manager for accreditation policy at the National Committee for Quality Assurance, or NCQA. So first of all, what is NCQA? And then I'll ask you, how did you come across this role?
Sure. So NCQA is an organization mainly in the healthcare industry, in the payer industry or the health insurance industry. They accredit health plans across the country. They're the most well known and well sought after accreditor of health plans. They also create and deploy performance measures. So I don't know if people may or may not be familiar with HEDIS. They have a whole suite of measures that helps to just use data from health plans that health plans have access to be able to inform outcomes. So for example, they have like a breast cancer screening measure where you could see like the percentage of people who have had their breast cancer screening within the past year or whatever it is. They do a lot of that, and also they're pretty progressive in their health equity work currently. So they have a brand new health equity accreditation program, and then they're really getting into those HEDIS measures that I mentioned, stratifying them by the different demographics or characteristics of a population. So that, just to help people really, and organizations really hone in on where the work needs to be done.
Okay. Well, thank you for sharing that. And yeah, I feel like it is an organization you hear about a lot, or not a lot, but a decent amount throughout your MPH program, at least for some people. So that pretty cool, pretty cool. I'll just put it out there first of all. So how did you come across this role?
In my previous position at IPRO, we worked a lot with HEDIS measures and just the different programs that NCQA has to offer. So I was doing a lot of performance measure validation of those performance measures that NCQA deploys. So making sure that the health plans that I was working with are calculating the measure correctly. Because, like with data, it's like garbage in, garbage out. So just making sure, that they're capturing the denominator correctly and that, they're capturing the numerator correctly so that, the rates, we know that they're actually accurate and valid. So again, with the data, this is theme of just data everywhere. So yeah, that's how I learned about NCQA. And so when I was at IPRO, I was thinking about, this was like during the pandemic, I was thinking about, okay, what can I do next? I knew I was moving to this area. And so I said, hey, what does NCQA have going on there? And so I came across this position, which is actually in the accreditation side of things as opposed to the performance measure side. But I thought it was really interesting and decided to apply.
Okay,
And the rest is history.
yeah, that's awesome. And I think it's also telling that the experience that you had working with HEDIS was kind of the thing that got you, oh, this is an organization I can work with, this is the type of work that I can work with, and then getting into that. So what do you do as the manager of accreditation policy?
Sure. I do quite a bit. Let's see. Primarily, I work on NCQA's standards and guidelines for health plan accreditation. So every year they release their standards and guidelines for the following year so that organizations can come through for accreditation. There's all different kinds of organizations. Primarily for health plan accreditation, it's health plans, but there are other programs such as like population health management programs or wellness programs that come through for accreditation. We have a whole suite of programs, but my job is to make sure that the standards and guidelines are clear and understood by the customer, which is the different organizations that are going to become accredited. So I do a lot of reworking of the standards, do a lot of clarification. We have Salesforce, which is like a customer, I think like a
CRM.
management system.
Yeah.
Yeah, yeah. So we got a lot of questions about our standards and guidelines from there. So just providing the clarification, doing the research on the policy, providing the clarification. I also work on our regulatory initiatives because I have had exposure with Medicaid and CMS, Centers for Medicare and Medicaid Services. I came into the job knowing a lot about the final rule. People will learn about this in school, probably in school of public health. I knew a lot about the final rule. I knew a lot about what CMS requires for managed care plans or health plans across the country. And I knew a lot about different states and what they require. So what that entails is a lot of reconciling the federal laws with our standards. We don't ever want to overstep CMS. So just making sure that things are aligned between NCQA and what we require and what the federal government or the state requires.
Okay.
And then I'm also on the health equity initiatives. So I'm a content champion for health equity accreditation. So right now we're working on actually releasing a new health equity product that will focus on social determinants of health, which is like public health. Like, yes, I'm here for it. So it's really exciting stuff.
Awesome. It seems like you got there at the right time.
Yes, for sure.
That's good. That's good. And I think you mentioned during your MPH you had an internship with a health plan.
Yes.
Was that really helpful in you like thinking through things with both IPRO and with NCQA, or not so much?
Yeah, it was extremely helpful. And it's funny because I started out as a community health and health behavior concentration, but it kind of morphed into this like health services kind of concentration. That internship really helped me to understand the landscape of our healthcare system. It helped me to understand like what is Medicaid and like how is that different from Medicare, and how does health insurance even work in the first place? So it kind of like laid the foundation for my two roles at IPRO and NCQA.
Okay, that makes sense. And yeah, health insurance is a complicated field that yeah, there's a lot that goes into that, and a lot that you can learn about it. So definitely makes sense. And I will dig into what does equity accreditation accredit what does equity accreditation look like?
Sure. So there's two different products. The first one is like the base program for health equity. It's like the basics. So if you're a health plan or if you're another type of healthcare organization, it's just really helping for you as an organization to internally get ready to serve your population in an equitable way. So it includes a lot of like organizational things like hiring diverse staff, doing different trainings on like cultural competency. It's making sure that as an organization, like a health insurance company, for example, that you have set up like language services and other types of infrastructure and programs to help your membership to get the best care that they can. And then so that's internally at the organization. And then the newer health equity work is about social determinants, which is very like external. So making sure that the organization that's coming through for accreditation has partnerships with like community-based organizations, making sure that they're collecting data like language, race, ethnicity data, but also the SOGI data, so the sexual orientation data, the gender identity data, um, and using that to be able to inform interventions for the population that they serve. So
Yeah.
it's basically requiring organizations to have like a foundation to be able to provide equitable healthcare in the first place.
Yeah, absolutely. And I think that is cool in the sense, well, it's kind of sad in the sense that this hasn't been going on for years, decades. Because if we don't have data, we can't really show that things are improving, or if they're getting worse, we can't like iterate from there. But it is cool in the sense that we are doing it now, and there is that big push. And I'm glad that organizations like yourself is doing this work, because we need this type of work. We need this kind of data to really drive forward our work, to really get at those inequities, to get at those just the health barriers, and creating more access points for people like yourself and myself, and people that look like us, to get the services and the care and the health, access to health, I should say, and access to opportunities that really allow them to live out their best health. Okay.
Yeah, it goes back to the whole, it's not just exercise and eating well. It's like sometimes you have to go to the doctor, but when you get there, you want to be able to have the most equitable care that you possibly can to help you in your health journey. So,
Yep, absolutely, absolutely. Okay, so before I move you on to the Furious Five, I would like to ask you, where would you like to see yourself in the future?
oh, that's a loaded question. Um,
Very.
you know what? In 5 years from now, I have no idea, but the sort of like overarching vision that I have for my life is I would love to become a full-time writer eventually. I currently have a blog that I write on occasionally. Um, but I would like to become a full-time writer and really just get into the space of behavior science. I am very fascinated by behavior science. I did study it a little bit in my concentration in my public health program, but just kind of getting the message out there for people to help give them ways, very practical ways to take action to change their lives for the better and become healthier. And
Okay.
then I also see myself traveling the world as well.
Also, is there any one place that you'd like to go to?
I would love to make my way down to like Fiji, New Zealand, like that part of the world. It's very far, but I would love to go down there. It seems beautiful. So.
Yeah, that is awesome. I hope that you are able to get out there for sure, for sure. And I'm not gonna like just pass from this. So I didn't ask anything about your health writing. Let's get into that a little bit. So what is the name of your blog?
It's just my pen name, Melina Renee, melinarenee.com, my first name, and then renee.com.
Okay, and what made you, when did you start this, and what made you want to start this?
I started it in 2017. I basically was just looking for like a creative outlet. I kind of touched on this before, but I've always, been pretty good at writing and I've always kept a journal. And I feel like I generally just have a lot to say. And people may get tired of me talking. So I decided to start writing, and it initially was supposed to be like a travel blog kind of a situation because at the time I was traveling a lot. And I do have travel blogs on there, but it's since turned into this kind of like personal development hub. I try to really focus though on like self-awareness. So I'm glad you mentioned that earlier, and how that plays a role in how people can improve their lives. And then I do want to start incorporating more like behavior science into it as well. But I do talk a lot about career. I talk a lot about like growth, self-awareness, like how to deal with all of the icky adult things that we're probably all facing at the moment, how to get through those things.
Okay, that's awesome. And I'll be sure to link that for anyone that is interested. And one thing that I like about what you said there is just like the general pathway to getting this is you started it off as a creative avenue for you to talk about your travels and whatnot. And it's just evolved into your personal project to do whatever you like. And I think we need more of that, like to create our own spaces. And as we develop in life and things shift and things change, we're just able to share our perspectives, whether that's about traveling or whether that's about behavioral science and improving people's health. So I just think it's like start it and then you can figure out all the other things and iterate as you go along.
Yes, it's evolved a lot over the years. So
Okay, so moving on to the Furious Five, the 5 questions that I ask all the guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I'm probably going to repeat what I said earlier, but don't be afraid of data. Walk into those epidemiology classes and those statistics classes with an open mind. I would say also to kind of, because public health is so broad and there's a lot of different things that you can do with it, really pay attention to like the things that make you excited and kind of light you up inside within this field, because that's how you'll know which direction to take with your career in
Yeah,
the future.
great advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Like my career position.
Yeah, let's do both career position and your blogging slash website.
Okay. I would say for my career position to really get familiar with our healthcare system as much as you can. It's very convoluted and complex, has a lot of moving parts, but understanding the fundamentals and just knowing, like I said before, like what is health insurance and how does one get health insurance? And when one gets health insurance, how does that kind of work and alongside like their healthcare? Just the basics of that is fundamental and very key to this work, because it's as much as like it's very exciting work, it's also very difficult. There's nothing easy about trying to improve the quality of healthcare, especially in this country where there's just a lot of moving parts and it isn't the greatest system. So just getting comfortable with that information and knowing the basics. In terms of starting a website, just dive in. Had no idea what I was doing when I first started. I just did like WordPress and just started writing things. If you look back at my earlier posts, you'll be like, what the heck? But just like really is just starting and just getting pen to paper and just publishing it. You'd be surprised at like how many people will appreciate whatever it is that you're doing, if it's outside of a blog or if it's some kind of art or whatever it is. Like you'd be surprised about how you can touch people with your work.
That is so true, so true. Get rid of the judgment and just do it, right?
Yeah.
Absolutely. Number three, what's something you're working on improving in your life right now?
Right now, I am working on taking back control of my health. And as it's funny because, as a healthcare professional, as a public health professional, sometimes we don't always take our own advice for our own personal life. And so just over the course of the pandemic and the last couple of years, like I really fell off with keeping up with my appointments and things like that. So just getting back into the swing of things and then just making sure that I'm prioritizing healthy habits, especially being so sedentary every day, getting exercise, getting up to stretch every once in a while I'm sitting here, holed up in this office at my desk all day. So just trying to improve my health so I can walk the talk.
Yeah, absolutely, absolutely understand that. Number 4, professionally, do you recommend anything?
In terms of a book, so there's this book that I read recently. It's called U-Turn, Y-O-U, Turn by Ashley Stahl. So it's a career advice book. But the reason that I want to recommend it is because it's not just this like stale career advice. It's actually, it has a lot of like actionable and practical advice in it. And what I love about it is that it really helps you to understand yourself as a person. I think getting to know yourself as a person and what you value and what skills you're naturally good at really help you to figure out what to do in your career. And it also helps, it's kind of like your guiding light too. Like if you're in a job where, let's say like your personal value is like integrity. That's one of my personal values. I have a lot of pride in my work, and integrity is just something I hold near and dear. If I'm in a position where that's being violated, where, I'm not able to produce work that really speaks to that value of mine, then I don't feel good. And so maybe it's time to make a change of some sort, whether it's leaving altogether or just like figuring out what I can do differently in that role. So this book really helps you to figure out like who you are as a person and how that translates to your career. So that's something I would definitely recommend people check out.
Awesome, awesome. I'll definitely add that to the show notes and add it to my ever-growing book list. And then number 5, last but not least, where can people connect with you?
Yes, people can connect with me on LinkedIn. I don't know if you want me to spell my name.
I don't think you have to spell it. It should be in the title. So it will be in the title. So you're good.
Yeah, so, yeah. If you just type in my first and last name, I'll pop up on LinkedIn. And then, like I mentioned, I have a website, melinarene.com, where I write about personal development. It says personal development for the soul because there's a lot of like self-awareness weaved into the stuff that I write. And then if you're just looking for advice on career and life, you can check that out as well.
Well, thank you so much for sharing that. Thank you for taking time to come on the show and share your insights, experience, and your journey. I greatly appreciate it. And I'm sure that all the other listeners or viewers definitely appreciate it as well.
Yes, thank you for having me. I really love this. Is so cool what you're doing, and I'm sure it's really touching and helping a lot of students and people in the field. So thank you for having me.
My pleasure. Thanks for being a part of it. So housekeeping items, everyone. Thanks so much for listening to this episode or watching it. Be sure that you subscribe if you have not subscribed as yet. Leave a like if you're watching this on YouTube or anywhere else that you can leave a like. A 5-star review would be appreciated, and share it with a friend. If you'd like to support the show, you can go to thephmillennial.com/shop and check out some merch from the Public Health Millennial store or Public Health store on the Public Health Millennial website, and support that way. But I hope you all are good, and see you all next week.